if you have dizziness from anxiety, first of all, that's not what you have. This is Dr. Alan Lifton from Brainsplained. I made a POTS video, and one of the comments was about a person who says they're dizzy all the time, and they've been dizzy for a year. And I think she meant continuous, nonstop, 1 year dizziness. There's about 5 kinds of dizziness in my mind. How I do things, I don't know if that's right or wrong, but in my mind there's 5. 2 of them are the regular dizziness. Regular dizziness comes and goes in some kind of spell. It's got a periodicity. It doesn't last nonstop for 1 year. That's not normal. And the 2 types of dizziness are the vertigo type and then the hypotensive type, or the posterior circulation dysfunction type. And there's a bunch of different causes for each of those. And so that's type 1 and type 2. And then type 3 is this chronic, nonstop, persistent dizziness. And then I have a category in my mind for not dizzy dizziness. Because, people come in with dizziness diagnosis, or they'll say they're dizzy, and they're referring to some kind of cerebellar dysfunction or some impairment of proprioception, something wrong with their brain or their spinal cord, or even a cognitive issue can be described as dizziness. So there's non-dizzy dizzy. And then I have a 5th category for weird dizzy or special dizzy, things like cervicogenic dizziness and dizziness from sleep deprivation, sleep dizzy. This is a thing, this persistent nonstop dizziness, which is what I think that she was talking about. The 2 big things in dizziness, and they help sort of get through things, is whether it's brainstem perfusion, lack of blood flow in your brainstem, low blood pressure type of dizziness, or whether it's vertiginous. Vertigo is the hallucination of motion. Hallucination is an experience that doesn't correlate with reality. If I see a pink elephant and there is in fact no pink elephant in the room, I'm having a visual hallucination. I'm seeing something not there. If I hear things, if I hear voices and no one else can hear them, and there are in fact no sound waves, then it's an auditory hallucination, although tinnitus is an exception to that. All of the sensory modalities can have a hallucination. I can hallucinate sensation of touch, of smell, of taste, and of motion, because I have motion sensation. I can feel myself moving. If I feel motion, but motion is not happening, that is called vertigo. Some people think vertigo refers to a violent spinning sensation, and a violent spinning sensation is a subtype of vertigo and is in fact a common variation of vertigo, probably the most common, but it isn't the only one. Any movement. So I could be moving up and down, or I could be moving side to side, or I could be moving front to back, or I can be moving this way or that way, or I could be moving sort of like that, kind of rocking. I could be moving as if I'm on water. If I have moving, if I feel like I'm moving, if I feel like I'm not moving, but the world is moving, any kind of moving, if there's motion involved in my dizziness, and that motion is different from reality, then we're dealing with vertigo. And it's important to find some way to get at that part of the story. If you have a physician trying to take care of your dizziness, he should be very clear, she should be very clear on this issue about whether it is or isn't vertigo, because it changes our differential diagnosis. The other kind, the lack of blood flow going into the posterior circulation, into the vertebrovascular system, and resulting in decreased blood flow into your alertness centers. And sometimes also that's confusing because there's vertigo with it, is often referred to as lightheaded. And those people have an urgent sensation they need to sit down or lay down. Their head feels swimmy. They feel like they're seeing spots. It may or may not come with stomach issues. It may or may not come with sweating. Observers will see it. They'll say they turn white, pale, or ashen. So your color and your face is drained and changes, especially if it's hypotensive, although it doesn't have to be, because you can get lack of blood flow in your brain without having generalized low blood pressure. The sensation is somewhat different, and the list of things that cause that is different. And in people who have continuous nonstop dizziness, it's important to get at whether it's continuously the brainstem ischemic type, or if it's the vestibular type, the vertigo type, or if it's neither of those. In the chronic vertigo, in my mind, I have 8 things in there. 6 of them don't matter, but they're in there, and those I generally I don't talk about very much. 2 of them are non-existent. They're not non-existent, but I never see them. So 2 of them are hyperventilation and anxiety. I've seen a lot of people who are sent to me for dizziness because they have anxiety. I've seen a lot of people sent to me for dizziness because they have hyperventilation. If you want to know hyperventilation dizziness, you can get it, and I do that. If you're doing cardio and you're doing short bursts of cardio and you want to perform better than you can, you should hyperventilate. So to hyperventilate, you breathe in and out very fast and very big. And the idea is to move a lot of volume of air. And if you move a lot of volume of air in and out, big, deep, very robust breaths quickly, by forcing yourself, you will hyperventilate. And in 30 seconds to a minute, you can feel weird and you will get dizzy. You may get nauseated. And that dizziness is the hyperventilation dizziness. If you want to know if a patient has that, then you hyperventilate them in the office and they get dizzy and it reproduces their dizziness or it worsens them and it's the exact same sensation. And it can be accompanied by dysesthesias, by tingling, pins and needles, or numbness, and very often is. Sometimes you can't hyperventilate people very well because the nausea is first. And about 10% of the people, or less, maybe 5% of the people who are diagnosed with that, who are sent to me, have it. So if you have dizziness from anxiety, first of all, that's not what you have. Anyway, that's the 2 things. And then there's the 2 things that actually happen, and that's going to be persistent perceptual positional dizziness and migraines. And those happen a lot. It's almost always going to be one of those 2. And then there are things that, I don't know, they need to be considered, but they get diagnosed. So chronic vestibulopathies, they're usually a structural cause, and people find those because most of these patients have had an MRI of the internal auditory canal. They have a vestibular kind of dizziness. It's a vertigo. A lot of times they end up being correctly figured out. Things that are correctly figured out, I keep them on the list, but I don't see them a lot, because they get figured out. Medications, sometimes I see that. Sometimes people get sent to me, they're dizzy, nobody knew why, and there they are, they're on clonazepam every day. And things with a long half-life like that, things with a 60-hour half-life or something, you never really get variations, so they don't have a diurnal pattern, they're just always dizzy. And the antihypertensives and stuff like that, you see that. And there's chronic central dizziness associated with brainstem dysfunction, white matter disease. People sometimes complain about it, people with brainstem lesions, and they're also kind of all, I don't know, they're all diagnosed. Maybe I shouldn't say that. Nothing is all diagnosed. And then there's non-neurological medical dizziness. And you have to keep that in mind. Some dizzy is not neurological. I actually did once diagnose somebody with aortic stenosis with no cardiac output because, I don't know why. You just examine someone, they have this huge murmur and you're like, hey, how long have you had this murmur? And they're like, I don't have a murmur. But you could be anemic and you could be generally hypotensive for Lord knows what. Sometimes it's not that. So those are the 6 things that cause chronic dizziness that are not likely what's causing chronic dizziness in somebody who is dizzy for a year. It's going to be usually, when I hear this, that somebody's dizzy all the time, 24 hours a day, 7 days a week, for a year's time, I'm thinking it's going to be that. So let's do PPPD. Normal brains don't always completely regulate everything exactly right. And I can go on the boat, and if I'm on the boat for a while, I can't go on the boat for an hour or 2, but if I'm on the boat for a while, if I'm on the boat for 6 hours or 10 hours, and I come back, and then an hour or 2 later, I feel like wobbly. I'm like, oof. And I feel like I'm on the boat, but I'm not on the boat. Or even for the next 12 or 24 hours, everybody knows that's okay. And the slang for that is sea legs. Nobody thinks anything about it. Everybody's had that experience. If that's annoying and it's persistent and it lasts for a week or 2 and it's just not going away, then it's called mal débarquement syndrome, because we can't come up with English words. We need to be French. And that literally translates to failing to debark. We don't have the debarking, getting off the ship word. And so when you get off and you don't get off properly and your brain doesn't get off, then you have this kind of feeling like you're on the water, this seasick kind of thing for a while. And it's vertigo, okay, because it feels like you're on the water. And you can get it from car rides and you can get it from plane trips, but I think boats are most common. And if mal débarquement syndrome is permanent, if it doesn't go away, then you have permanent vertigo. It just never goes away. And for the history, many people don't remember the inciting event. They don't remember that they started this after a trip. Some do, but some might not. And it's a shame that that illness gets not diagnosed, and it's eminently treatable. It responds to physical therapy very well. That can make you dizzy for a year. And sometimes people don't think it's connected to the inciting event too. And the other thing that makes somebody dizzy all the time forever is a migraine. And I hate talking about acephalgic migraines, but you can have a migraine that doesn't have a headache, acephalgic migraine, and you can have a headache that doesn't go away. And you can have an acephalgic migraine that also could be vertiginous, but more often it's the ischemic type, the chronic one, not the other one, because episodic vestibular dysfunction, episodic vertigo is in the elderly is a pretty common migraine manifestation. That's in a different section, so we're not talking about that, and that's done through mostly timing and maybe with associated features. I have so many migraine patients who don't have migraines. It's very stunning. So some of my migraine patients have eye pain, but not migraines, it's eye pain. Some of them have sinus problems, but not migraines, it's sinus problems. Some of them have face pain. Some of them have pressure, head pressure, but again, it's not a migraine. It's not even a headache, just pressure. Okay, they'll tell you that. They'll tell you it's not a headache. Some of them have neck pain, but not headache, not migraine. And neck pain, eye pain, face pain, pain in your teeth, not pain, pressure. All of that can be a manifestation of migraine, or no pain at all and just neurologic deficits. I had a patient who used to look like he was having a stroke. He would become paralyzed, and he had absolutely no headache, and it was his migraines. We kept thinking he was having a stroke. He kept coming into the ER. Absolutely no headache. Did it about 20 times, and then on like 21 time, he finally got a headache, but headache isn't required. We managed to figure out it was migraines prior to his having a headache with one of them. And so the migraine that is continuous and nonstop and presents with dizziness could be either the vertiginous type or the lightheaded type. Regardless of what kind of dizziness you have, it's a little bit difficult when it's chronic to necessarily see fluctuations. Some people will say, oh, it's better if I lay down, it's worse if I stand up. Some people will say the opposite, but it doesn't necessarily help. If I had to guess about that patient, knowing nothing, it's going to end up that she probably has one of those two. She probably has a chronic migraine, acephalgic with either nothing or some hints that it's migraine, or she has PPPD. Anyway, I hope that's brain splained.